An introduction to shockwave therapy. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, certified birth healing practitioner and pelvic floor physical therapist. So what is shockwave therapy? Well, it's a healing modality and it's got an 82% success rate when it's used for certain injuries or certain issues in the body. And what it does is it uses radial pressure waves or ultrasound waves in order to get deeper into the body and boost healing. So how does it do that? Well, it improves blood flow, lymph circulation. So think about the fluids in your body. It helps that move a little bit better. And it actually boosts your body's ability to regenerate its tissue. So it works really well on soft tissue. So things like muscle, connective tissue, tendons, and ligaments. Okay, it doesn't work so much on healing of bone, but you might have an issue around, say, a joint or a bony structure, and you're going to have a lot of muscle, tendon, connective tissue around that same area. So it really targets that soft tissue. So there's some really good science behind the shockwave therapy and how it works, and just proof that this cascade of events happens in the body. So think about it in a way, a lot of times with injuries or especially chronic conditions, think about your body being kind of in this cycle of inflammation, and it's trying its hardest to heal, but it gets kind of stuck like that. And so you might just have this sort of lingering pain or lingering dysfunction in your body. And so what the shockwave therapy does is actually comes in, it kind of gives it what I tell my patients, inflammation with a purpose. So it kind of breaks that cycle up and gives it an exit point so your body can then do its own inflammatory process and knows exactly what to do in that cascade of events. So again, good blood flow to the area. That's going to help with circulation of the lymphatic flow of your body, as well as helping that regeneration of your soft connective tissue. So who can be helped with shockwave therapy? I'm going to talk more specific on who we're helping here at the Healing Spot, because quite honestly, this machine can be used for a lot of different body parts, a lot of different areas of the body, but I want to talk more specific on who we're seeing here at the Healing Spot for shockwave therapy. So we're seeing women that are concerned about postpartum healing. So we're using it for just to improve the core and the pelvic floor function. And then we're also helping with menstrual pain as well as other female-related symptoms. So into the lower abdomen and directing it really low into the bladder and the uterus area, and helping with scars. So we've had some women coming in for help to break up the scars of their C-section scar or abdominal scars, as well as scars from other surgeries like bladder surgery or even the late effects of post-hysterectomy surgery, where we have all that tightness kind of in the lower abdomen area. Some other things that we've been seeing people for with shockwave therapy here is lower back pain, joint pain, glute pain, or like piriformis syndrome. We're getting some really good results with the women that we've been seeing so far. And a couple other women that we've seen recently have been coming in for things that we don't normally see here at the Healing Spot, but women that are coming in for some postpartum healing for pelvic floor and core issues. We have one mom that's had some wrist pain, and it's really hard for her to pick up her baby and the car seat and things like that. And another woman that we're seeing for some elbow pain as well. So this type of therapy can help a lot with tendinopathies, tendinitis. Like I said, it can really help with that soft tissue inflammation, whether it be acute, meaning it's happened more recent, or whether it's more on the chronic side, where it's been there for quite a while. Before I go into a short demonstration of what shockwave therapy looks like when we actually apply it, I want to just say a little bit about what to expect, like how many sessions, what is it, what does the course of a typical treatment look like? So what the clinical evidence is showing is that around 6 sessions done at a weekly interval, so every 7 to 10 days to do these treatments, you get the best results with that. So after those 6 sessions, what we're looking for is an improvement in function in some way. So whether that be we want to see at least a 50% improvement in pain reduction, or improved mobility or even function. Okay, so if we're using it for something like bloating or constipation, or some pelvic floor issues in that regard related to the bowel or bladder function, we're going to be looking at, is the bowel or the bladder doing better? Is there less leaking? Is there increased or ease with emptying the bowels? Things like that. Are the scars a little more mobile? So we're looking for a 50% improvement or more within those 6 sessions. Then what we do is we give the body a period of time, up to 12 weeks, in order to let the body do its own thing and integrate the boost that we've given it with the shockwave therapy. So then we check in after that 12-week mark, after that last session, to see, has there been even more improvement? What's the function? So us as physical therapists, we have tests and measures that we start with, whether that be we're asking questions about your symptoms, but also we're doing tests to see what is the mobility, what's the function of whatever problem you're dealing with, so that we have some baseline information when we start, and then we recheck that as we're going on through these sessions. And then at the end, after that 12-week mark, we're going to re-look at things and see what's been the improvement from where we started to where we're ending. And then if we decide that maybe 1 or 2 more sessions is needed, we would talk to the patient about that. Okay, so I'm going to show you a little demonstration here. We're going to do some shockwave to the lower abdomen. So I'm just going to prep the area, basically just making sure we don't get her clothes all goopy. So what I'm going to do is right along the lower abdomen. So with shockwave, we're going to do 3 steps. The first step is going to be this vibration paddle. And basically think of it like a massage. Okay, it's going to bring blood flow to the area, help with that lymph circulation, and kind of prep the area. So what we do is we use just a little bit of ultrasound gel. So this is going to be a little chilly. Okay, we don't have a warmer for this, so sorry about that. Okay, so then what I'm going to do is, I'm going to do for demonstration purposes a short treatment here. Okay, so I'm just going to get this all, I know it's cold, right? Okay, so I'm going to turn this on. And we just go over the area. So I like when we're doing something like working with constipation, like chronic constipation or not emptying the bowels, to actually follow the line or the movement and orientation of the intestines. Okay. So again, this feels good, kind of like a little massage, prepping the area. Okay. So this next step is going to be the shockwave itself. Okay, so we have these different sound heads that go onto our gun or pistol handle here. And with this is going to be delivering the ultrasound waves, okay? And you're going to hear it, it's under pressure. So I tell people it's kind of like a little air compressor that's delivering those ultrasound waves. So what we're going to do is begin this. We're going to follow that same line that we did earlier. And I'm going to start out real low with this. So typically what a patient tells me is they feel is almost like stinging or like little needles. I've also heard it kind of feels like a rubber band kind of snapping. So, and what we do is we want to establish enough energy where someone is feeling about a 4 or 5 on a discomfort level. So if 0 is no pain at all and 10 is excruciating emergency room pain, we want to be delivering enough energy where you're feeling a kind of a medium discomfort with it, okay? So I'm going to go ahead and start with this, and you're going to let me know if I need to adjust it, if I can go up or I'm at the lowest that I can go. So you can kind of hear it. So again, I'm just going to follow the same line that I was doing earlier. And like I said earlier in this video, this can be done in a lot of different areas of the body. I just thought for this video, for demonstration purposes, this is a nice area for you to be able to see. How are you feeling with that? Are you feeling any discomfort at all? Okay. So then I can adjust this and go up a little bit. So what we want to do is establish that 4 out of 5, and we want to keep that energy there at that level throughout the treatment. And treatment here depends on what we're doing, how big the area is. Again, those evaluations skills that we have, we're going to go back to what it is that what tissues we're targeting, how large that area is, to decide how long of a time we're going to do this step. I'm going to go ahead and turn this off. Okay. And then we have a third step, and I won't go into all of that, but basically this second step of ShockWave is delivering the radial pressure waves. And think about, we're kind of prepping the area and getting a larger area, and that's really loud. And then we do a smaller sound head, and that's going to be more focal. So we're trying to find those trigger point areas and really seeking out the areas of tension or pain for our patients. After we do the 2 steps of ShockWave, then we have the option of going back and finishing up with the vibration paddle again, which can just help things feel a little bit better. Again, bringing blood flow to the area and helping with just general circulation and pain relief. So if you would love to learn a little bit more about ShockWave therapy, head to our website, healingspotpt.com, and check out the tab along the top that says ShockWave therapy. You'll learn all kinds of great information there. And if you are curious if maybe this can help you as part of a comprehensive plan working with our physical therapist, then reach out to us, pick whatever option is the best for you on our website, talk to our member of our team, sit down with one of our therapists, and let us answer all the questions that you have and talk to you about a customized plan of care, which may include ShockWave therapy as well as our other services. Thank you so much for watching this Ed Talk. I'll see you on the next one.